Good news for the residents of Jersey. The island has taken significant steps towards a more relaxed and hopeful phase in its battle against COVID-19. Starting from the 1st of April, health care and emergency services will have the autonomy to decide on mask-wearing policies for their personnel. In a move reflecting the decreased demand for rigorous testing, pre-admission screenings in healthcare settings will transition from PCR to LFT tests. And there's more good news. If you test positive, the stay-at-home guidance has been shortened to just 5 days. While LFT kits remain accessible online, the universal availability will come to an end, and all non-diagnostic testing is set to halt by the 30th of June. Professor Peter Bradley, Director of Public Health, emphasized the island's unwavering commitment to its citizens. Our priority is and always will be the health and safety of islanders. The changes we're announcing today echo our sustained approach to managing COVID-19. Professor Bradley strongly encourages everyone to remain vigilant. If you feel under the weather, stay at home and consider taking an LFT. As we move forward and adapt to the ever-evolving situation, let's keep the health and well-being of our community at the forefront. Stay safe, Jersey.